Okay, you're a baby, you've just been born, you're not talking yet. You've got your mouth shut, you've got your chin on your chest. Right, 3 things. 1. Okay. So, most babies are brilliant at doing that. Most babies, if the midwives and the mothers and the obstetric doctors, if they've done their job, the baby comes out, oh, thank you sir, the baby comes out and is healthy. And the baby is healthy enough to be able to do what we just did. Open up our airway, take a deep breath, and make a noise. Most babies, when they're born, are healthy enough to do those 3 things. Some babies can't. And our job is to spot the ones who are going to have a problem, who need some help. Because the best thing in the whole world is getting a baby who looks very sick, who looks very unwell. And you look at this baby and you think, oh, this is not good. And you use this, just like I'm going to show you, and then 5 minutes later, you hear the baby crying. 10 minutes later, the baby is on the mum's chest. 15 minutes later, the baby is breastfeeding. It is the best feeling in the whole world. Okay, whether you live in South Sudan or Uganda or England, it doesn't get any better than this. Okay? And my job today is to teach you how you should know when you need to do those things and how to do those things. And your job is to make sure I do it right, because it's so important. Is that okay? So, Dr. Lawrence taught you about ABC earlier, didn't he? He mentioned A, B, C. Ooh. This one. A, B, C. Do you remember yesterday, those of you who were in my lecture yesterday, we started with D, R, S. Can anybody remember what the D was for? Danger. Okay? So the danger is about your danger, but also the danger of a bad environment. What is a good place for a baby to be born? What things does a baby need for it to be a good environment for a baby to be born? What do you think? What's a good place for a baby to be born? On the flat surface. And you're right, it doesn't matter if that's in a referral hospital or at home or in a clinic or a maternity unit. It needs somewhere flat. What else? Yes, sir?
Clean environment.
A clean environment. It is so important that we think about hygiene and cleanliness right from before the baby is born. So we give this baby the best chance of being clean and healthy and not getting infections. Thank you, sir. What else? Yes, sir?
Baby needs oxygen.
Okay, so we're all breathing oxygen at the moment. Okay, and that's why this is such a good thing, because it can push oxygen into the baby's lungs. So it's nice to be able to plug this into an oxygen cylinder, but even if it's not, there's still oxygen in here. So sometimes we have to help the baby, but the baby needs oxygen. So we've said a flat environment, a clean environment, an environment where they can breathe because there's oxygen. What else? Yes, ma'am. Space, exactly. So you need space for the mother and whoever is with the mother and the people looking after them to be able to do what they're doing. And they also need to be able to see what they're doing, don't they? So if it can be lit, nice and well lit, That's a good thing. Now, why did we wrap up the baby? What don't we want to happen to it? We want it to be warm, don't we? Okay, look at this. The baby's head